That's gonna take me a moment here. Okay.
Let everybody know that we are recording this webinar now. So we'll be able to share it later and we can refer back to it later.
Oops. Okay, I will go ahead and share my screen and then start the slideshow in a moment here. Maybe. Okay, it's gonna take me a minute. Okay. All right, can we see this? Let's start at the beginning. Okay, here we go. Sorry about that. I'll start. Can everyone hear okay? I'm just gonna hope we can because I can't actually see the I can't see the chat anymore. Okay.
Yeah.
So first, my name is Autumn Shirley, and I am the grant administrator here at the Ozark Small Business Incubator. I will be here just to administer this particular Howell County CARES Small Business Relief Grant. So I'm here to answer any questions you have about the grant process. Today we'll go through, we'll briefly go through what the application process looks like. We'll hit on a few important points, and most importantly, we'll answer any questions that you have about the application, the process, and the qualifications. So just a quick overview of the business incubator. We are the Ozark Small Business Incubator. We're here in West Plains, and we serve roughly the same area as the Small Business Development Center. And we work to counsel new and existing businesses by providing mentoring services, counseling, microloans. We have all-inclusive office space and a lot of other resources, really important resources for small businesses. So please feel free to reach out to the incubator if you have other questions about your small business management as well. All right, so moving right along, today we're going to talk a little bit about this particular Howell County CARES grant for small businesses. And the first thing we need to do is just to determine if this is right for you. So these are a few of the qualifying factors that you'll need to meet in order to be able to apply for this grant. First, your business needs to have been in operation on March 1st of this year. That's important because the CARES Act was passed on March 27th, and it extends back to March 1st, covering a period from March 1st through December 30th. Your business does need to be geographically located within Howell County. If you have other businesses or branches that are located outside of Howell County, you should contact your county commissioner for that county regarding possible grant funds. If you have received any other federal funding due to the COVID-19 pandemic, such as a PPP loan or an EIDL advance, you may still qualify for the CARES Act grant, but you cannot overlap the funds, and that's really important. So it needs to be very clear on your application that you received a PPP loan, for example, and it covered a period from, let's say, March through June, just for example. You cannot request CARES reimbursements for the same things or the same period that were covered by that PPP loan. So that needs to be very clear. We need to be able to clearly show that this is not a double dip, so to speak. And then finally, you need to have incurred unexpected or unbudgeted expenses that are directly related to the pandemic in order to be able to request reimbursement through this grant. This grant is not for replacing lost income, for example. It's specifically for reimbursement of expenses incurred due to the pandemic. So those are the main qualifying factors for the Howell County CARES grant. Now, some key points to keep in mind if you are interested in applying is that there is no limit to the amount of funds that you can request. It's limited essentially by how much you have spent or will spend, that is. So you also can request pre-approval as well if you would like to purchase a large piece of equipment, for example, and need to know if you'll be approved for that before you make that purchase. You can get pre-approval on this grant application. Possibly. Obviously, I cannot guarantee that it will be pre-approved, but I do encourage you to talk with us about applying. Each request needs to be directly related to this COVID-19 pandemic. You need to be able to show a direct connection between the reimbursement you're requesting and the pandemic. You also need to have paid receipts for each of these reimbursement requests. If you bought a bunch of masks back in April, but you don't have the receipt, we can't help you with that. Again, this cannot be emphasized enough. The funds from this grant cannot be used for any purpose that you've already received federal funding for. That includes the PPP grant or the EIDL advance and potentially other federal funding sources as well. So any federal monies that you've received need to be very clearly separated from each other. A payroll reimbursement is available through this CARES grant, but it only qualifies if the employee in question has been substantially dedicated to mitigating the effects of COVID-19. And we'll talk a little bit more about that further on in this presentation as well. And then finally, this grant covers a period from March 1st through December 30th of 2020. And that means that if you are approved for reimbursement, particularly if you're pre-approved, you need to use all of those funds by no later than December 30th of this year. If you have not spent them for whatever reason, you will be required to refund any portion that was not spent in the required time period. So this slide, I'm not going to go over every single one of these, but this is essentially the paperwork and the records that you're going to need to gather in order to apply. And this is all listed on the application as well. So you don't need to memorize this. Just glance over it. I'll hit on a couple of them. First, the SBA Form 641, that's one that we're getting a lot of questions about. And essentially what that is a counseling request through the Small Business Development Center, because OSB and the SBDC are partnering to help you through this application process, which means that you can come to us at OSB or to SBDC for assistance. And we want to record the time that we spend counseling you. So you'll be able to complete that electronically as part of your application process. You'll see the link to that on our website as well. The other thing that we've had a couple of questions about are the copies of the PPP and or EIDL applications. If you received those funds or other funds, we need to see that paperwork so that we can clearly show that there's no overlap of the funds. And then finally, you also need to be able to provide receipts or invoices for everything for which you're requesting reimbursement. We cannot pre-approve it or reimburse it if we don't have a receipt or an invoice from a third party indicating the total amount due or spent. Okay, so let's talk a little bit about the application process itself. I know when you first look at it, it looks like a big, complicated, convoluted process. But I think once you start working through it, you'll find that really the most difficult part of this application process is gathering the supporting documentation. The application itself and the spreadsheet, the expenditure detail tracking spreadsheet, are both fairly straightforward. My recommendation when you start with this application process is that you begin with the spreadsheet. The expenditure detail tracking spreadsheet is a really helpful tool. It has each of the 6 categories separated into tabs, and then it has a tab at the end that totals everything up for you. So this is a good place to start, especially if you're just wondering, Do I even have enough expenses to bother with this application? Start with the spreadsheet, put your expenses in each applicable category, and we will talk a little bit about those categories later in the presentation as well. So put your expenses in those categories, and then look at the totals. If the total is $100, you might not want to spend the time required to go through this whole process. But if you end up with a few $100s or more, I think it's well worth your time, and this will help you kind of see that. It's also going to help you have a feel for the type of documentation you're going to need to gather, and for where to put each of the expenses on the application itself. So always recommend that you start with the expenditure detail tracking spreadsheet as you go through this application process. And you'll see that that spreadsheet is available on the website too. And I will be sharing the link to our website where you can find all of this documentation at the end of the presentation. So I'm going to cover briefly each of the 6 categories for which you can request reimbursement. We are getting a lot of questions about these. This terminology is copied directly from the instructions included with the application. So you don't need to memorize this either. You'll see it in the instructions, and I'll talk a little bit about additional things that might qualify, and I'll answer questions about them as well. So the first section that you're going to see on the application, and so also the corresponding first tab in the expenditure detail tracking spreadsheet, is medical expenses. And this one is actually pretty straightforward. This covers expenses related to medical clinics or responses or testing for COVID-19. So if you have incurred, as a hospital or clinic, for example, if you have incurred COVID-related expenses, those will go right in here. If you've established any type of temporary public medical facility, if you've incurred costs for providing testing or emergency medical response expenses, or even disposal of hazardous materials, those type of expenses will go in here. This could also be used for purchasing equipment to help prevent the spread of the disease. For example, if you were purchasing a sanitizing wand, you might consider putting it here in medical expenses. Okay. So the next section is public health expenses, and this one is for expenses that are incurred due to acquiring personal protective equipment. So if you're buying a lot of PPE for your employees or your customers, that would go in here. Disinfection of public areas and other facilities, particularly things like nursing homes or, again, clinics or hospitals, that can go in here. If you have had to quarantine individuals and you've incurred expenses related to that, that would go here under public health expenses as well. Payroll expenses. So I'm going to talk about this in a little bit more detail because, as I said earlier, payroll expenses are only qualifiable or reimbursable if the employee in question is substantially dedicated to mitigating or responding to the COVID-19 emergency. Now, again, this language is taken directly from the federal guidelines. We don't make these rules. We simply are abiding by them. But I do want to point out that this does open an opportunity for businesses to reassign an employee or even to temporarily hire a new employee to public safety. That employee could be assigned specifically to sanitation, for example. I think this will be particularly useful for restaurants and other businesses that deal a lot with the public, retail stores. Businesses like that could bring on an employee, or again, reassign an employee for sanitation, specifically for sanitation. If that employee spends most of their time going over cleaning, disinfecting, and sanitizing the space, then their payroll could be reimbursable. So section or question 4 is called facilitate compliance. And basically this means things that you have done to facilitate compliance with the CDC guidelines for public safety during the COVID-19 pandemic. This would include if you have, for example, food delivery, and you've needed to purchase additional equipment to keep your food completely separate from everything and sanitary. If you need to set up distance learning, so our public schools, for example, would fall into this category. They could easily request some reimbursement for costs involved with online learning. If you are setting up teleworking capabilities, so if this is not something that you did before, but now you're working and you need to have faster internet, a different phone system, tablets, webcams, things of that nature, anything that you weren't originally planning for, but have now incurred expenses due to the pandemic, could probably come into here. This includes sick and paid family leave for employees who do come down with COVID-19. Another thing this would include would be, let's see, I think this is the one. Yeah, I'm not sure. I might come back to this slide toward the end just to look at this again quickly. But I think this is the section that so far we are seeing the most reimbursement in. This is probably where the majority of our small businesses are going to fit. Economic support. So this one is also pretty important. This category covers expenditures related to the cost of business interruption caused by required closures. Now, the mandated closures, that 6-week period, that may have been covered by a PPP loan. So we need to be careful there. But if it wasn't covered, if you did not get a PPP loan and you did incur expenses when your business was required to close, or if it is still closed out of an abundance of caution, you can likely put those types of expenses here under economic support. So this is another really important category to keep in mind. It's not very clearly defined. You can see here it lists reimbursement due to business closure, reimbursement of unemployment insurance, and then some state, territorial, or government payroll support programs. But we have been counseled to include additional expenses caused by business closure in economic support. And then finally, section 6 is just other, and this is sort of the catch-all for other costs that your business has incurred due to the pandemic, which did not fit neatly into one of the other categories. So we also are seeing quite a bit of stuff in here. And again, I'll look over this whole process with you in the next slide. So don't just put everything in here. If you have specific questions about which category something might fit into, you can call us and we'll help you to make that determination. If we get an application and every single reimbursement request is in other, it's going to raise some red flags. So use this as the last option. So if you've gone through the spreadsheet, you will have seen each of those tabs corresponding to each section that I just covered. You now will be at the final tab of the spreadsheet, and this is where it will calculate all of the totals for you. So the last tab is really kind of your summary, and I think I have one here. I'll show you. Let's see. It looks briefly, you know, like this, I know you can't see that very well, but this is going to be handy for you. It tabulates everything by section, so you don't have to go through each tab again as you're filling out the application. So you're going to take the totals that you find on the last tab of the spreadsheet and put those into questions 1 through 6 in section D of the application. You're also going to take the total calculated, that's total amount requested, total of all sections, and put that into section C1 of the application, which asks for the total amount of funds requested by applicant. That particular question has been left blank by several applicants, which is why I'm emphasizing it here. It is important that we not only have the total for each section, but also the total amount of funds requested. So don't skip over that session or that question. So if you do that, if you go through the spreadsheet, then you complete each section and you put the total amount of funds requested, the next step is to go through the remaining questions on the application, and those are pretty straightforward. The only thing I would add here is be sure that you actually do check either yes or no every time it asks. Don't leave any of those blank because that's open to interpretation, and you don't want anything like that. If you need to go back and you know, hand write that in for whatever reason because you've forgotten to do it, please do so. And then finally, once you've gone through the spreadsheet and the application and you've gathered your supporting documentation, we recommend that you bring it to us at the Small Business Incubator to review before you go through the process of having it notarized, because that way we can look it over with you and make some suggestions if there are any recommended changes before you have it notarized. So that's what we recommend in the process. Fill out the application, fill out the spreadsheet, gather all your supporting documents as if you're ready to submit it, but then bring it to us to look at one final time before having it notarized. And then this is the link for the application on our website. It's osb.com/HOCOMO Cares. That's short for Howell County, Missouri Cares. You can email us with questions as well, hocomocares@osb.com. And of course, I also encourage you to call. We've fielded a lot of calls from people who just need additional assistance going through this application process. We'll be glad to set appointments and meetings with you. And Daryl at the SBDC and the whole team there is also glad to help with the application process. So this has been just a quick overview of the application and the, you know, each section, and the rest of the time is really dedicated to questions from you. Have we seen any questions so far, Daryl? Can I?
Nope, nothing yet. Chad or Suzanne, do you have questions? You can unmute yourself and ask or type it in the chat.
I have no questions at the moment.
The only question I might have would be, as Autumn and I talked about, our corporate location, which is in Thayer, Missouri, obviously Oregon County, has been open for 6 years, but the West Plains facility was not purchased until July. And so, you know, if you look at the wording, it says business must be open since March 1st. So theoretically, the business was open, but not the location of Howell County until July. So I don't know if we would qualify or not. Trying to get some clarification on that.
I would think it would be if you, was it a separate FEIN number for the new location or?
No, it's the same.
Well, I think that's a really good question, and I don't have a firm answer for you yet, but we have fielded that to the Howell County Commission and are hoping to get some further clarification from them today, Suzanne.
Okay, great. I have another question. So I didn't see anything specifically in there regarding this, but I mean, we have put some things in place like extra sanitization and, you know, supplies and things like that, but we are getting ready to do some remodeling, adding a couple of offices because we've had some areas where we had several people in the same, you know, scheduled to be in the same area.
Yeah.
And so to, you know, just to meet social distancing requirements, or to be compliant, we are going to be adding a few offices and some restrooms. And those things look like they will be done before the end of the year. Would that be something that you think would be, would work as a, that would be, can't think of the word I'm trying to use, that would be fit into one of those categories?
Yes, if you're taking on costs to facilitate compliance with the recommended guidelines, social distancing in this case, I would consider that to be a reimbursable expenditure. I would think that that would fall under facilitate compliance. What are your thoughts, Daryl?
Yeah, I would think so. I mean, you emphasized often that it's only if those expenditures were necessary for compliance.
Yeah. Again, I really can't emphasize enough that you need to make the case for the connection to COVID-19 very clear. One of the things that we've been kind of counseling people to consider is that we are going to ask you a lot of questions and get a lot of clarification for you in this process. So we at OSB are going to have these answers. The commission is going to ask us these questions. So we will be kind of going over it again with the commission. But who knows how long down the road the federal government is going to actually audit the care funds and look at where these funds went. They're not going to ask you those questions. They aren't going to ask anything. They're going to make their entire determination based on the application and the supporting documents that we send with it. So it's really important that they can see the direct connection between your reimbursement request and the COVID-19 pandemic. And the place to make that connection is going to be in, I believe it's column B in each of the tabs on the spreadsheet, where it asks essentially, how does this, please describe how this relates to the COVID-19 pandemic. That's where you need to make your case crystal clear. It might seem super obvious that hand sanitizer relates to COVID-19, and it kind of is, but you still need to say, okay, so it's not always column B, it was column C in payroll, but in each tab of the spreadsheet, there is a column that asks you to explain in detail the intended use and how it meets the criteria. So that's where you make your case. There's more room than it looks like. You can type quite a bit into that cell. Please don't hesitate to do so. It should be really clear. Hand sanitizer, we purchased hand sanitizer in order to kill the COVID-19 virus. I mean, I know that sounds dead simple, but it really needs to be. So please put that in there. The other place to make your case for the reimbursement request is on the application itself. There's a question that asks you to describe your business and how it was impacted by the pandemic. And on the application, there's not a lot of room. It's about enough for a paragraph. But we encourage you to put an attachment with your application, just going into more detail about it. Tell us about your business. Tell us how COVID-19 interrupted it and how, if you are still being impacted by it. Outline all of that so that it's a very clear case for receiving these funds.
Sounds good.
Yeah. Yes. Thank you, Daryl. It's question number 20. Describe the general business operations of the applicant, such as services or goods provided, purpose of the business, and how the business has been affected by the COVID-19 public health emergency. That last part is really important. Again, and you'll get tired of hearing us say this when we review your material, but we we think we can't emphasize it enough. The Treasury and the Secretary of State and all the guidelines have said that this needs to be very, very clear. So. Okay. Does that answer your question? Probably a bit more than you were looking for there. Susan.
That's great. No, is more, the more I know ahead of time, the better.
Good, good. Any other questions today?
I don't have any.
Nope.
Thank you,
I'm
though.
good.
Mhm.
Yeah, like I said, we'll share this recording as we can, and hopefully we'll get the word out to have more people take advantage of the information so it saves time in their application process.
Thank you guys so much.
Well, thank you both. And Suzanne, I will follow up with you when I hear back from the county.
Okay, I appreciate it. Thank you.
All right.
Great.
Thank you.
Thanks, everybody.
Thank you.